Good. All right. Good afternoon, everybody, and welcome to our 4 p.m. update. A lot of good news today. Good economic development news. Generally good news on the COVID front, though cases are still too high. So let's get to it. On Thursday and Friday of last week, I announced more than 1,200 new jobs for Kentuckians through just under $300 million in new investments just for the month of January. That was just in the 2 days of last week, positioning us for the best January we've seen in years. But today, we have even more good news as we close out a banner month. Today, I'm proud to announce another jobs announcement that Vector Corrosion Technologies will establish a manufacturing facility in Lexington, creating 20 new full-time jobs through a $1 million investment. This is a Canadian-based company, and the facility being developed on Winchester Road is their first U.S. operation, so a really big deal. But what does that mean for January? It means we have announced $660 million in new investments for January alone, including 1,400 new Kentucky jobs just created in the last 30 days. The companies come from all over the world, and they're betting their future on us. They include Aristech Surfaces in Florence, 20 new jobs, Russellville Dental Lab, 32 new jobs, Novellus in Guthrie, 140 additional jobs, Quadrant Magnetics, 200 jobs in Louisville, 80 Acres Farms, 125 jobs in Florence, Levi Strauss, 300 new jobs in Erlanger, Eurofins, 9 new jobs in Louisville, Confluent Health, 350 new jobs in Louisville, Kroger, 161 new jobs in Louisville, Piston Automotive, 67 new jobs in Louisville, and Ragent Corporation, 48 new jobs in Moorhead. We are truly on the cusp of an era of prosperity that as we push through and get past this pandemic, as we deal with short-term inflation, it's going to create really bright and optimistic days ahead for us and our people. We have arrived. Never a flyover state again. We are the destination. We're the destination for $660 million in new investment and more than 1,400 new jobs in January alone. And you know what? It's not just us that's noticing. On our ongoing effort to attract new investments in the Commonwealth while continuing to be fiscally responsible, it's having a positive impact on the experts' view of Kentucky. On January 28th, S&P Global Ratings revised Kentucky's financial outlook to positive. The outlook was formerly stable, now positive. S&P cited a reduced reliance on one-time items to balance the budget and a higher balance in the state's rainy day fund as primary factors influencing the change. This improved outlook also incorporates my 2022 to 2024 executive branch budget recommendations. So their outlook on where our economy is, not stable, but positive. On what our economy would look like under my budget recommendation. Again, not negative, not stable, but positive. Our continued economic recovery, including significant investments like Ford Motor Company and SK Innovation's decision to build what we believe will be the largest battery production facility in the United States, were also cited by S&P as key to the decision to revise Kentucky's outlook to positive. You know, with all the negative that we've had to deal with, positive feels pretty good. And to have S&P, and I don't know how long it's been since they viewed Kentucky's economy as positive, to validate all the good things that have been happening and that we have been seeing, that ought to be a good end of the month in January or a good start of the year. Remember, lots of businesses look at S&P and their outlook. And so for anybody telling you we don't have a great economy or a good business climate, well, the experts disagree. They think we're pretty positive. All right, on to our COVID report. First, I'll go through the last 3 days. Then we're going to talk about how last week, for the first time in a while, we had less cases than the week before. So on the 29th, we had 9,144 new cases, 31 new deaths, included a 42-year-old from Edmonson County. On the 30th of January, 5,821 new cases, 25 new deaths. And today, 4,950 cases, 14 new deaths, and that includes a 38-year-old woman from Fayette County. Now, as we'll talk about here in a second, cases down versus the week before for the first time in a long time, but also down our positivity rate, which had reached over 33%, now down to 28.49% today. So let's look at our stair-stepper chart. As you all may recall, this was going up and up and up at an alarming pace. Near the end of last week, in the very least, we thought that the increase was significantly slowing. I think what we have seen, or what we hope we are seeing, is a cresting and hopefully the beginning of the downward slope in Omicron cases. Certainly, as we look at other places that got hit with Omicron before we did, we have seen a steep decline in cases. Now, let's temper this news a little bit. Last week was still the second highest amount of cases that we've ever had, and it was more than double the peak in Delta. But the trajectory is a good sign, and provided we continue to see declines this week, we would expect even greater ones next week. But we're not out of the woods. If we can hold on and do the right thing for 2 to 3 weeks, we hope that it will drop as quickly as it rose. So just last week, 74,376 cases, down from 81,473. We hope 2 weeks ago is the most cases we will ever see in a single week. Positivity rate, that stair-stepper chart looks even a little better. It's not only lower than, last week was not only lower than the week before, but also the week before that. This is typically our leading indicator. And so we certainly hope that between these 2 points of data, total cases and positivity rate, that we are headed in the right direction. 2 weeks ago, 33.1%. Last week, 28.97%. Hospitalizations, little more concerning. Remember, those lag behind cases and positivity rate. We are incredibly close to our highest level of hospitalization due to COVID that we have had. And deaths are still much higher than we'd like to see. We're still losing a lot of people. We hope that we'll start to see a downward trend in hospitalizations. The small tick you see at the end, we see every Monday. So that should not suggest that we are already moving downward. We're going to have to get further into the week to see that. This is the most concerning chart, because whether or not these people are very, very sick or just sick enough to be in the hospital, this means there aren't enough beds for so many people that are harmed in other ways. This is something that we need to see a significant decline on. I will say, in other states that got hit faster than us, or cities, they have had a corresponding decline that lags the decline in cases and positivity, and we certainly hope to see that. I think all of us have that expectation. It's just the when and how much longer will our hospitals be pushed to the brink. ICU, not quite as bad. Again, I think what you see here is the difference in severity on how sick Delta made people versus how sick that Omicron makes people. But remember, if that many more people get COVID, even a smaller percentage of people getting severely sick can lead to the same amount or potentially even more deaths. And then there's the ventilator numbers. They went up, but Omicron hits your body in a different way than Delta, which would result in fewer people being on a ventilator. So, listen, it's our second highest week in cases. It's our third highest week in positivity. It's one of the worst times for hospitals, but it looks like we are starting a decline, and that would be wonderful. It's going to take a little time to bear that out, but you ought to believe that there is light at the end of this tunnel or this surge. Now, some places in the state got hit a little later than, say, our urban areas, which got hit first. So for some places out in the state, if you're looking at local cases, this might be the highest week. But all of us think we're at least close to turning the corner in the right ways. One of the reasons is that more people are getting vaccinated and are getting boosted. And that's even with the number of people that, first of all, have gotten vaccinated and boosted. And then the folks that have gotten COVID and have to wait a period of time to get vaccinated now that they've had it or boosted. Still, we have thousands of people every week and over 1,000 people every day that show up for the very first time to get vaccinated. Over the weekend, 5,899 Kentuckians deciding for the first time to get vaccinated. 5,500 and change getting fully vaccinated. 12,899 getting boosted. That's a really important statistic. Fighting this battle in the future, getting to the endemic phase, really getting back to normal is going to take having that level of immunity. Getting it one way or the other, getting it the booster way is certainly the safest. Once again, data from the CDC is showing the importance of a booster shot when it comes to protecting ourselves against COVID-19. You can see the chart on the screen of the weekly average deaths per 100,000 people from October 2021 to November 2021, and the chart speaks for itself. While the vaccine provides incredible protection, the booster shot provides even more. In fact, deaths of those that have gotten a booster is almost zero. Look, people are dying because of the lack of a vaccine. These shots are safe and effective. If you haven't gotten it yet, get your vaccine. If you haven't gotten your booster, don't put it off for any reason. Go in and get it. Your level of protection will be significantly increased. If you got the Pfizer and Moderna vaccine, you're eligible for a booster 5 months after your second dose. If you got the J&J, you're eligible 2 months after that shot, and you ought to go out and get it as fast as you can based on the data that we have seen. All right, so speaking of emergencies, given that COVID is certainly one, today I'm announcing the appointment of Colonel Jeremy Slinker as the new Director of Kentucky Emergency Management effective March 1st. Colonel Slinker, who's here with us today, will replace the outgoing and the irreplaceable, though we've got to replace him, Michael E. Dossett, who is retiring. Well, he's retiring on March. He was trying to retire February. His last day is February 28th. He's trying to retire in December. Michael spent more than 44 years in public service. He has done a great job. He has been a good friend to me and to all Kentuckians. Director Dossett initially announced his retirement in December 2021 before the deadly tornadoes hit Western Kentucky, but remained with the agency to manage the Commonwealth's initial response, and we greatly appreciate that. So, Colonel Slinker, who we are getting, has been in public service for almost 30 years. He is currently the director of the Ranger Division for the Kentucky State Parks, where they have brought in folks rendered homeless by the tornadoes and taking care of them. And I will tell you, as park rangers, we're picking people up in the middle of the night before the storm was even passed and bringing them to safety. Before that, he served in the Kentucky State Police for almost 25 years as a trooper in an all supervisory ranks. I think he was maybe even number 2 right near the end of his service. Colonel Slinker's service in law enforcement leadership exemplifies a required skill skill set that you need in emergency management. He's held command positions in post operations, special operations, and drug enforcement special investigations. In 2016, he was appointed to the Kentucky State Police Command Staff as the Special Enforcement Troop Commander, and in 2017 was promoted as the Operations Division's Director. Colonel Slinker's experience in crisis management makes him the right man to lead this organization, and we're going to have a couple months where he can work directly with Director Dossett. I have full confidence in Colonel Slinker, and I'd like to introduce him to Kentucky. Colonel? Congratulations.
Thank you, Governor.
Please.
Good afternoon. First, I'd like to start with just saying I'm going to miss my park ranger team and all of my parks family. It's been a great place to work, and they're out there serving every day, serving the Commonwealth. But with that said, I'm deeply honored and humbled that this position with the KYEM, Kentucky Emergency Management, will allow me to continue to serve the Commonwealth in that capacity. I look forward to working with the federal, state, and local partners to address issues that are currently going on and in the future. And as the governor said, I'm very appreciative that Director Dossett has decided to extend his retirement and give me an opportunity to learn and hopefully gather some of his expertise moving forward as well. I'll be committed to this state, as I've always been, to help make it a safe and prepared place for the Commonwealth, the Kentuckians of the Commonwealth. Thank you.
Thank you.
Governor.
Well, in addition to running large operations in both the state police and in parks, Colonel Slinker has also been detailed at different times to emergency management. He has been in the command post in numerous of these emergencies in roles at both KSP and parks. You're the right man for the job, and I know Kentuckians are going to be appreciative of your service. All right, we have some good news today as well for low-income Kentuckians needing help with heating and cooling bills. Kentucky has been awarded over $1.5 million additionally through what's called the LIHEAP program, the Low Income Home Energy Assistance Program. Eligible households will be able to access vital support with paying utility bills. LIHEAP also provides crisis assistance, weatherization, and other services that help keep Kentuckians safe in their homes. The $1.5 million is the first installment of a 5-year, $500 million investment in LIHEAP by the bipartisan infrastructure bill. Residents interested in applying for help for paying heating and cooling bills can call the Kentucky Low Income Home Energy Assistance Program. That is 1-866-674-6327. And it wouldn't be a week in this state without needing to talk to you about weather or a concern that we have. We had Colonel Slinker today, and he'll be watching this carefully. A large and significant weather storm is expected to impact much of the central U.S. in the mid to late week time frame. Substantial amounts of rain, snow, and ice, it is possible this will be another ice storm, are going to be possible in portions of our area with this storm, depending on the eventual track of where it goes. Right now, the biggest impacts are expected across southern Indiana and north central Kentucky from late Thursday through early Friday. Stay tuned. This is just Monday. We're trying to get this information out as early as we can. But what we have learned over the past 2 years is we all need to be prepared, because it seems like when an emergency can hit us, it does. We have avoided the last 2 weather events in January, but we've already had 2 states of emergency this month alone. So do everything you need to be prepared and be ready if needed to be able to manage in a day or 2 of ice or snow or whatever it is we face. All right, with that, we will open it up to questions here in person. We have one journalist, Mike Valenti.
Thank you, Governor. In an effort to understand more factors that are causing the labor struggle, the Brookings Institution found that millions of Americans are still struggling with what we know as long COVID, those symptoms. Do you have a rough idea of how many Kentuckians are experiencing those symptoms, what those symptoms include, and what kind of treatment they should pursue?
Right. So one of the COVID's dangerous for a lot of reasons. It's dangerous for how many people it kills, the 3rd leading cause of death. And when you're competing with cancer or heart disease, it means you are deadly. We're going to probably this week pass 13,000 total deaths, which means it's killed more people in a 2-year period than any 3 wars that Kentuckians have fought in combined. It's dangerous because it fills up hospitals and can cause other deaths by lack of capacity to help. It's dangerous to our economy in that if enough people get sick in a business as quickly as it spreads, it can impact productivity. And it's also dangerous in long-term health, damage to lungs and in other areas. And it's still a brand new virus, right? We had our first case less than 2 years ago. And so we are still learning about the long-term impacts and frankly, how to treat them right now. Our first long-haul COVID patients, some of which have gotten better, some of which have only gotten partially better, and some of which are still struggling. And I think we're going to see, like we saw with treatments for COVID. I mean, if we went back to April of 2020, remember we had not enough PPE, we had not enough testing, we had no treatments for it. It had killed 2,000 people in New York as it swept through. There were tent hospitals set up in Central Park, and what we were facing then has changed a lot to now with lots of different treatments for all the different various variants that we've had as well. I think we're going to see that here as well. How do we rebuild lung function? How do we deal with some of the seemingly nerve damage? And it also appears to manifest so differently in so many people. So I think a lot still to learn, but I do believe we have a very committed healthcare infrastructure working on it. I do not believe that we have any solid number of overall Kentuckians suffering from long-term COVID, but we did have, and we'll try to pull them back out, some federal estimates on percentage. And the percentage was a little bit scary about total number of people that have had COVID and have long-haul symptoms. What we also don't know is will different variants produce different levels of it. But this is something between processing the grief and continuing to treat the long-term impacts that we're going to be dealing with for a while. Tom Latek, Kentucky Today.
Thank you very much, Governor. Good afternoon to you. I kind of want to go off topic here. I remember during, the height of the pandemic and the UI fraud that you had to deal with, there was also some involving state employees. Can you tell me how many of those cases you've had and what the outcomes were and how the investigation is of the outside UI fraud cases?
I know that investigation and potential prosecution of those matters is being looked into. The Attorney General's office and others. We want to work with any prosecutor or groups of prosecutors on it. There are also federal agencies that look into the same thing. Could be FBI, could be others as well. Certainly, any ongoing investigations that I'm aware of, I can't comment on because that could compromise the investigation itself. We've made public numbers of employees that access their own claims, as well as different administrative actions taken because of it, including termination of at least one of those individuals. Karen Zard, WUKY.
Thank you, Governor. Thank you, Rachel. Governor, looking at the trends in other states who surged before us with Omicron, when do you anticipate that our hospital numbers will peak, and are we prepared? And is there an update on the travel trailers in Western Kentucky? Have more been able to be hooked up since Friday? Thank you so much.
Friday was amazing. We got to get families out of single hotel rooms or single rooms in our lodge, get them in brand new 28 to 36 foot travel trailers. The kids were beaming. You could see the families felt a sense of relief and dignity. It was a whole lot of smiles, and the superintendents were there at each event because it was their students that they would be able to pick up with the bus at those site locations to get them to school. One of our superintendents was even taking notes on which kids had been placed, so that he was working real time to make sure they were in the bus schedule. We believe, and we're setting them up right now, that we will at least double the number of folks that are set in a travel trailer this week. They will all be in those same 2 locations as we look at more. I know we were just in Bremen looking at what's possible there as well. Based on trends from other states, we believe our hospitalizations will peak. The question is, how far are the hospitalization numbers, people going in and then people getting out, behind cases and positivity? Certainly that is our hope, and we'll be watching it very carefully. Debbie Yetter, Courier-Journal.
Hi, Governor. You mentioned that it looks like Kentucky may be turning a corner on COVID cases in terms of the numbers and positivity. What does that exactly mean for us in the future? I know we've kind of been here once before, and then Delta came along. So, are you? Do you feel like making any predictions?
Well, every time we think we know where this virus is going, we are wrong. Let's remember, this virus has one goal, and that's to kill as many of us as possible. It will continue to try to mutate when it can, to continue to try to kill as many of us as possible. You know, I know we get tired of rules changing, but when the enemy changes its tactics to try to kill more of us, then we have to change our tactics to keep as many of us possible alive. Certainly what we expect to see in the coming weeks, if we've turned the corner, is a reduction, hopefully a significant reduction of cases. My hope is between vaccinations, boosters, and the number of people who've been infected with Omicron, and we'll see what that natural immunity does or does not do, that we will at least have a period of time of lower case numbers, which would be really exciting. I'm sure that we would all feel a lot more back to normal. It remains to be seen whether enough people have gotten this and it provides enough natural immunity, and the vaccines and the boosters continue to provide strong protection, if this is the beginning of the end or if this is another dip in our journey. But what I do know is we are strong enough no matter what it throws at us. Our people of Earth have dealt with a number of these, one every 100 years, and we are still here. They were strong enough to make it through it. We just have a responsibility with the science and the knowledge that we have that wasn't available to previous generations to do it better. Melissa Patrick, Kentucky Health News.
Hi, Governor. So some states are suspending their test to stay programs in their schools, saying the program has little impact with so much infection. What is Kentucky's current stance on this program, and are there still enough tests and school resources to make this work? And I'd also like to know if you've signed Senate Bill 100, the Essential Caregiver Bill.
I believe that Senate Bill 100 has been enrolled. It hasn't made it to my personal desk to review. So again, we're going to review it, and then we will take action. We believe in the Test to Stay program. We believe it works. It's working in my kid's school system, and I think other superintendents would tell they think it's a valuable tool in theirs as well. We believe that school systems are doing a good job with it. We have a huge number of schools and systems enrolled in the program. We have the dollars to keep it going for at least a couple more months, and that's even under the Omicron demand for tests, which we think will lessen. But we think it is an important and valuable tool when it is paired with universal masking. A test to stay program where you don't have universal masking might not help a lot, because by the time you are doing those tests, somebody could have spread the virus to others, and others that have it are spreading it from there. So we believe that these two mitigation tactics need to be done in concert. And when you do that, the quarantine rules are loosened as well. April Rickard from WFPL.
Hi, Governor. Thank you. What percentage now of hospitals are facing critical staffing shortages, and is the National Guard still helping? And second, are there non-COVID patients who've been unable to receive care due to the capacity? Thank you.
We don't get reports when non-COVID patients can't get care, but what you do is you hear about it anecdotally from lots of folks. And yes, we are hearing that in certain areas where people try to go to the hospital and cannot get a bed. And it's happened everywhere in America at one time or other during this. And then the other question was percentage of. April, can you ask the first part again?
Yes. What percentage of hospitals are facing critical staffing shortages, and is the National Guard still helping?
Yes. So the National Guard is helping. We've actually increased our presence by about 10 guardsmen in one additional hospital. And I want to be careful with the distinction here. About a third of hospitals have reported critical staffing shortages. Now, I say reported it. Some of them aren't reporting it this time around because they know what we face. They know we've got to push through it, and they know there's a light at the end of the tunnel. I think in all practicality, every hospital has a critical staffing shortage right now. But as opposed to Delta, we see a trend, and we knew from last week there's a trend where you peak and it decreases. So fewer are sounding the alarm, even though they are in a tough place. A lot of them getting their staff back who have had COVID. So again, we hope we're rounding the corner. We know that hospitalizations will decrease as cases decrease. We've just got to push through to get there. Okay, we did this in 31 minutes today. I'm sure no one is upset about that. We will be back on Thursday for our regular Team Kentucky update. Thanks.